All
All
right.
right.
We are
We are
live.
live.
All
All
right.
right.
Let me make
Let me make
sure
sure
this is in
this is in
a
a
locked.
locked.
Which one's it this?
Until this time. Okay.
And
And
it,
it,
yes.
yes.
This mic
This
is
mic is
extra good
extra
today.
good
It's
today. It's
picking up
picking up
everything.
everything.
Is what now?
I can
I
hear
can
like
hear
the
like the
paper
paper
falling
falling
from where
from where
Nyla is
Nyla is
from my
from my
mic.
mic.
Why does it
Why
keep
does it keep
looking?
looking?
One more time. Okay.
Okay.
All right.
All right.
There we
There
are.
we are.
Give me
Give
one
me one
second.
second.
I'm
I'm
telling you
telling you
today,
today,
it's just
it's
gonna
just
be
gonna
what
be
it's
what
gonna
it's
be.
gonna be.
Alrighty.
Alrighty.
We can go
We can
ahead
go
and get
ahead and get
started.
started.
Yay.
And
And
I'm going to
I'm
let
going to
you
let you
introduce
introduce
yourself
yourself
Okay.
really quick.
really quick.
All
And
right.
I'll
And I'll
introduce
introduce
myself
myself.
and go from
We'll
there.
go from there.
All right. Well, hello, everyone. This is Dr. Mama Fifi, Felicia Hunt here. Um, Kicking it with Shabreon, and I'm so glad to be here. I am a warrior. I have SS. I'm a mother of a 37-year-old. I am a golden warrior, I should say. I just turned 57 on October the 30th. So excited about that. And yeah, I am a marriage and family therapist by profession and a certified sex coach. And I just love being here today to talk about some things that we as warriors and golden warriors go through. And so, with that, I'm going to pass the mic.
Alrighty.
Alrighty.
Hello,
Hello,
everyone.
everyone.
I
I
am
am
Shabreon
Shabreon
Howard,
Howard,
aka
aka
Shabreon the
Shabreon the
Advocate,
Advocate,
aka
aka
Chef Shay
Chef
Made
Shay
It.
Made It.
Depends on who
Depends
you
on who you
ask and what
ask and
day.
what day.
But
But
I
I
am a
am a
filmmaker,
filmmaker,
photographer,
photographer,
An author.
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 Listen,
Listen,
what
what
else do I
else do
do?
I do?
A mother.
I'm a
I'm a
mom
mom
of a
of a
beautiful
beautiful
almost 10
almost
year
10
old.
year old.
It's
It's
less than a
less than
month
a month
away.
away.
Whoa.
Whoa.
I'm
Nice.
doing it. Her little
Her
finger
little finger
flashed across
flashed
the
across
camera.
the
So
camera.
I
if
So
you
know.
heard
you
her,
heard her.
I mean, if you
I mean,
seen
if you
it,
seen it.
I saw it.
yeah.
Yeah.
It lets you know she there.
hmm
hmm
I'm
I'm
also the
also the
daughter of
daughter of
a
a
sickle
sickle
cell
cell
patient.
patient.
My
My
mother passed
mother
away
passed
from
away from
complications
complications
when I was
when I
7
was
and she
7
was
and she was
25.
25.
And
And
I'm just
I'm
an
just an
advocate
advocate
and an
and an
overall
overall
creative
creative
being
being
who use
who
my
use my
talents
talents
to
to
bring more
bring more
awareness
awareness
to sickle
to sickle
cell and
cell
mental
and
health
mental health
issues.
issues.
Yeah,
Yeah,
that's
Yeah,
who I
that's
am.
who I am.
that's who she is, y'all. So, what we talking to the people about today, Shay?
Well,
Well,
I had to
I
do
had
a
to do a
PowerPoint
PowerPoint
because
Did
that's
you?
because that's
I wouldn't
I
be
wouldn't
me
be
if I
me if I
didn't.
didn't.
Do you
Do
hear an
you hear an
echo? Is it
echo? Is
just
it
me?
just me?
If it's
If
just
it's
me,
just me,
that's fine.
that's fine.
I think it's just you. I don't hear an echo.
Okay then.
Okay then.
I'll deal
I'll
with
deal with it.
it.
Yeah, because if I heard it, I would let you know because I'm at the end of the day and I'd be like, girl, whatever that sound is getting on my nerve, but I don't hear it.
Manage.
Manage.
Okay. So
Okay.
I,
So
as I
as I
stated, I have a
stated, I have a
PowerPoint.
PowerPoint.
So we about
So
to
we
get a
about to
little
get a
bit
little bit
smaller,
smaller,
so we
All
can
so
get
we can
right.
get
on
on
to
to
this.
this.
All right.
All
So
right.
our
So our
topic for
topic for
today
today
is
is
kidney
kidney
disease.
disease.
Yes.
Now,
Now,
that is a very
that is a
broad
very broad
topic.
topic.
We're
We're
trying
trying
to
to
specifically
specifically
cater this
cater this
towards
towards
our
our
store
store
with
with
our
our
experiences,
experiences,
kidney
kidney
disease,
disease,
kidney
kidney
failure, whatever you
failure,
want to
whatever you want to
call
call
what you're
what
going
you're
through.
going
I don't
through.
like
I
to
don't like to
claim
claim
those
those
words of
words of
failure,
failure,
Correct. Correct.
so I
so
don't
I
really
don't
say
really
it
Disease
say
often,
it
and
often,
failure and all
honestly.
of
honestly.
that. Mm-mm.
Yeah.
Yeah.
But
But
I
I
digress.
digress.
I will
I
say
will say
this.
this.
We're
We're
gonna we're gonna give it
gonna
to
give it
you
to you
straight up,
straight up,
no
no
chaser.
chaser.
And if
And
by
if
the end
by
of
the end
this
of this
people still
people
have
still have
questions,
questions,
we will
we will
continue to
continue to
answer.
answer.
Whatever you
Whatever you
need,
need,
people,
people,
we are
we are
here.
here.
Okay?
Okay?
So
So
we already
we
did our
already did our
introduction.
introductions.
We need to okay, we
Okay,
did
we
that
did
too.
that too.
Okay.
Okay.
How does
How does
one
one
get
get
kidney disease?
kidney disease?
Ah,
There's various
that is
That is
a
a
ways.
multifaceted.
multifaceted.
Yes, it's like for me, I woke up in ICU with the doctor standing over me talking about, we're gonna have to put you on dialysis. I'm like, what? I just woke up. Like, wait, give me a moment. What happened? What even happened? Like, how did I get to ICU? It's like I had lost time of my life, right?
Mm-hmm.
And all I know is I was dealing with some sort of like an infection, a cold. It wasn't COVID, and I think I had sepsis. And I don't know. I passed out at some point because a friend, ex friend, was taking me to the hospital. And from walking outside my door and getting into the car, that's all I remember. I don't remember anything else. I don't know how she got me to emergency or how they got me out my car, how they, whatever they needed to do for me. I don't know how long I was under. I don't know if it was hours. I don't know to this day if it was days, really. And that was back in 2001. I was on um, dialysis because my numbers was off, really off. The creatinine, they called it the numbers that they look at. I think I was at like a 10 or something, and it's like 0.01 or whatever, the norm. And so, um, he was just saying, we just want to clean your blood. And I took him at face value because my mom, she got kidney failure from high blood pressure. So I knew about kidney failure from my mom. And I knew with having sickle cell disease that any part of your body can be damaged as a result of sickle cell. Wherever the blood flow, you can have a crisis. And when you have a crisis, it's like that organ or that muscle or that tissue or whatever is like kind of dying because there's no real nourishment, oxygen, and all that stuff getting through, because everything is stuck. And so, literally, parts of you is dying until all of that comes back. And so, anyway, I just knew how it was for my mom back in the day. It wasn't nothing easy. She had to go like 3 times a week for, out, 3, 4 hours or whatever. And it didn't make her feel good afterwards, and I was young. I didn't know how to advocate for her. I didn't know what to really look for. And so when the doctor told me I had to be on dialysis because of my situation, then I really wanted to pay close attention. I wanted to see, has medicine changed, and see if I could learn something that I didn't know from my mother's experience. And so, come to find out that you can get your kidneys cleansed, and you don't necessarily have to get fluid taken off. Now, sometimes when people have kidney damage, that means that they can't pee, or they're not peeing, or they're not peeing very well, and it bags up into their body, and you get fluid on the body. And not only are you getting fluid on the body, but your blood is not being cleansed through the kidneys. So certain things are not being cleansed out from the kidneys. And so all of that gets backed up into the body. And so, like potassium and phosphorus and things of that nature. And so they just want to clean the blood and make sure those things, the extra stuff, come out. So when I learned that, I was like, oh, okay, well, I just want them to clean my blood. I don't want them taking off any water, because in my mind, I'm thinking if I have them take off the water, then my kidney's gonna be like, well, what do I need to function for? You taking the water off and ain't giving me nothing to work for, so why should I work? So my kidneys were still functioning in terms of excreting out the urine, but the part that's supposed to clean the blood was the part that is not working so well. And so then I said, okay, then let the machine do that. So the first year in 2021, I think I was on dialysis for about 7 months. And then after that, I was off for like a year and 3 months, because I was really learning how to take care of myself through diet and, just watching what I eat and getting a dialysis, only getting my blood clean. So my numbers were coming back to normal. But that's how I found out that I had kidney failure or kidney disease, through waking up in ICU.
Wow.
Wow.
Definitely.
Definitely.
I said
I
that's
said that's
definitely
definitely
something.
something.
Like
It's
it's crazy
crazy how
different
different
things
things can
trigger it
trigger
to
it
be
to
so
be so
bad.
bad.
Because for
Because
me,
for
right,
me, right,
I've been
I've been
struggling with
with
kidney
kidney
disease
disease
for
for now.
and
And then
just the
just the
combination of
combination
being
of
put
being
on
put on
inoculation
inoculation
medication
medication
because it's not
because
great
it's
for
not
your
great for your
kidneys. It's
kidneys. It's
hard on your
hard on your
kidneys,
kidney,
as
as
a matter
as
of
a
fact.
matter of fact.
Um,
Um,
as well
as
as
well as
you
you
said,
said,
because for me,
because
I'm
for me,
like,
I'm like,
okay,
okay,
well,
well,
I don't want to
I
take
don't want to
this,
take
so what can
but
I
what
do?
can I do?
I'm
I'm
thinking
thinking
I'm doing
I'm doing
myself
myself
one
one
better by
better by
just taking in the
taking in
lead
the
after I get
after I get
home
home
from the
from the
hospital
hospital
instead
instead
of
of
being on my
being on my
medication
medication
or
or no
naproxen or something like
something
that.
like that.
But
But
in the
in
long
the
run,
long
the long
the
game
long game
that
that you're
you're looking at
looking
here.
at here.
I think
I
it was
think
just
it was just
a lot of
a lot of
contributing
contributing
factors
factors
that went
that went
into,
into,
just the
just the
slow
slow
progression
progression
of the
Mm-hmm.
of the
disease over
disease
time.
over time.
And then I'm
And
not
then
gonna
I'm
lie,
not
when
gonna
I was
lie, when I
young,
was young,
I was
I
young.
was young.
Okay,
Okay,
I
I
always had
always
in
had
my
in my
head that
head that
kind of a
kind of a
fear
fear
because you were
because
put
you were
a
put a
expiration date
expiration
on
date
your
on your
life,
life,
right?
right?
Mm-hmm.
So
So
I'm like, oh,
I'm
I'm
like,
gonna
oh, I'm gonna
go
go
low.
low.
You know what I
You
mean?
know
I'm
what I
gonna
mean?
live
I'm
my
gonna live my
life to the
life to the
fullest,
fullest,
and
and
doesn't help.
doesn't help.
And off
And
of
off of the
genetics,
lyrics,
because
because
my
my
mother
mother
also
also
had kidney
had kidney
disease. That's
disease.
something
That's
I
something I
watched her go
watched her
through
go
as
through as
well.
well.
So
So
all of those
all of
things
those things
contributed to
contributed to
kidney
the
disease.
kidney
I
disease.
think
I
what
think what
took it up a
took it
notch
up a notch
and
and
really
really
changed
changed
it
it
shifted
shifted
from,
from,
okay, you
okay,
have
you have
kidney
kidney
disease,
disease,
careful,
careful,
to, okay,
okay,
we're looking
we're
at
looking at
dialysis,
dialysis
would be
would be
when
when
I was in the
I was in the
hospital
hospital
and I was
and I
given the
was
little
given the little
fluids
fluids
because
because
the
the
hospitalist
hospital
did
did
not
not
want
want
to
to
consult with
consult
the
with the
kidney
kidney
specialist and
specialist and
nephrologist
nephrologist
in a
in
timely
a timely
manner,
manner,
which could
which
have
could have
saved my
saved my
kidney.
kidney.
But
But
Mm-hmm.
after
after
that
that
visit,
visit,
um,
um,
my
my
kidneys,
kidneys,
the
the
function went
function
down
went down
10%. So I
10%.
went
So
from
I
a
went from a
26
26
to a
to a
16,
16,
and it
and
never
it
went back
never went
up.
back.
Mm-hmm.
So it
So
was
it was
just,
just
from that
from
point, it
that
was
point, it was
very
very
frustrating
frustrating
because I had a
because I
lot
had
of
a lot of
I had to
had to
really
really
advocate for
advocate for
myself
myself
because I knew
because I
that,
knew that
because I knew
I knew
I just
I
couldn't
just
let
couldn't let
them give
them
me
give me
anything,
anything,
especially
Mm-hmm.
especially
without
without
consulting
consulting
with a
with a
nephrologist,
nephrologist
because it
because
shot
it
me in the
shot
foot
me in
and
the
threw
foot
everything I
everything
did.
I did.
So
So
it
it
it started
it
giving
started
pretty
giving
bad.
pretty
I
bad.
said
I
more
said
like
more like
the beginning
the
of
beginning of
2023.
2023.
I was
I was
having
having
to
to
get
get
dialysis
dialysis
while I was in
while
the
I was in
hospital,
the hospital
just to
just
kind
to
of
kind of
get my
get my
numbers
numbers
back
back
to
to
a
a
safe
safe
stage.
stage.
But
But
you know,
you
as hard as
as
I
hard as
fought,
I
because
fought,
they
because they
told me
told me
in
in
2021
2021
that I was
that
going to
I was
need
going to need
dialysis,
dialysis,
that I needed
that
to
I
start
needed to start
preparing
preparing
myself, I had
myself,
to get all
fistula,
these
all these
things.
things.
But I
But
did a
I
lot
did
of
a lot of
different
different
things:
things:
detoxing,
detoxing,
juicing,
juicing,
special
special
vitamins.
vitamin.
And for
And
2 years
for 2 years
straight,
straight,
they kept
they
saying,
kept
"How
saying, "How
you doing it?
you doing it?
You just
You
miss
just miss
needing
needing
dialysis."
dialysis.
I'd
I'd
rather
rather
just miss
just miss
needing it
needing it
than to
than
need
to
it.
need it."
Mm-hmm.
So
So
I did
I
that
did
for
that for
2 years. That
years.
was
That was
good
good
because
because
it
it
really
really
forced me
forced me
to
to
look inside
look inside
myself,
myself,
challenge myself,
challenge myself,
grow,
grow,
do what was
do what was
necessary
necessary
for
for
me
me
to stay
to
as healthy
stay
as
as healthy as
possible.
possible.
Right.
So I just
So I
started
just started
dialysis
dialysis
basically
basically
in
in
August,
August,
because it was the
because
end
it
of
was the end of
July.
July.
And
Mm-hmm.
And
yeah,
yeah,
it's been an
it's been an
experience.
experience.
I know. I had to get back on earlier this year, March, because the numbers fluctuated again. But when you were getting on, I was supposed to be getting off again. But my insurance changed. So I had to see a whole new set of doctors. So right now, that's what I'm doing. I'm seeing a whole new set of doctors. And it's still on the table whether they're going to take the port out and have me come off of dialysis again, or if this is something that I have to keep doing. Right now, I'm just going twice a week for 2.5 hours. because, like I said, I'm still maintaining through my diet. I'm keeping my weight down, doing all I can to really follow the rules. But just the way the hemodialysis make you feel is they explain it like your blood has just ran a marathon. And so when they put the blood back in you, as the blood go out and it comes back in, and when you're done, it's like you're so exhausted. You're just so exhausted and so tired because you ran a marathon that you didn't know you were running.
Yeah,
Yeah,
definitely.
definitely.
And I'm telling you, the most you could do is just let me just hurry up and get home so I can get in bed, and relax and recover.
Yeah.
Um, I just didn't know what my mom was going through because sometimes, like it even make your skin itch a little bit. And she used to itch all the time or feel some kind of way, and you can't put words to how you feeling, and it's like you don't even know what to ask for the relief you know um I
Yeah,
didn't
I
I
definitely
definitely
researched that
researched that
as well
as
because
well because you know me.
I'm
I'm
in the
doing the
research.
research and stuff.
uh,
I said I
And I
researched that as
researched that as
well, like
well, like
the itching,
the
because
itching, because
I had
I had
a
a
point
point
where
where
mm-hmm,
I would
I was
itch so
so
bad. I
bad.
would
I
wake up
would
out of
wake up
my
out of my
sleep.
sleep.
mm-hmm.
I would
I would
it was
just,
just
just
like,
like,
I don't like
I don't
itching,
like itching,
right?
right?
That has
Has
like
like
itching for
itching
me
for me
can be
can be
associated with
associated
my
with my
anxiety.
anxiety.
So
So
it
it
triggers
triggers
something I don't
something I
need
don't
to
need
be.
to be.
So
Girl.
So
I did
I did
find
find
out
out
that
Mm-hmm.
that
like
like
nerve
nerve
pain
pain
pills,
Right.
pills,
like
like
Lyrica.
Lyrica.
It does
It
work
does work
because I
because
tried
I
because I
tried because
already
I
had
already
the
had the
Lyrica
Lyrica
for
for
something
something
else
else
for my
for
nerve
my nerve
pain,
pain,
and I
Mm-hmm.
hadn't
and I
been
hadn't
taking
been
it
taking it
because
because
again I don't
again I
really
don't
take
really take
meds like
meds
that.
like that.
Um,
Um,
but when I
but
took
when I took
those
those
meds, I was
meds, I
like,
was like,
okay,
okay,
now I
now
could
I could
feel
feel
better and go
better
to
and go to
sleep.
sleep.
Yeah, them nerves get offset or something. I don't
Yeah,
know.
Yeah,
it's a
It's
it's a
like
reaction.
reaction.
crazy,
Yeah,
Yeah,
you know. And sometimes you just feel them nerves in your body doing something, and you just sitting there cringing because it's like it's a weird feeling, weird feeling.
I
But
say
I
it
there's
say
makes
it
nothing
me
you
makes
can
like
me
do
my
like
about
my
body
it,
is
body is
vibrating.
vibrating.
huh?
I say it
I
makes
say it makes
me feel
me
like
feel
my
like my
whole
whole
entire body
entire
is
body is
vibrating.
vibrating.
Vibrating, yeah. Um, sometimes I try not to look crazy because sometimes it just hits you in unopportune times, and you don't know where you at, and your body just start to do its own thing because these nerves are just popping
Hmm.
off, and then making you do weird jerks and stuff like, what's that? Um, it's crazy.
All right,
All
so
right,
next
so next
question.
question.
Did the
Did the
doctor keep
doctor
you
keep
well
you well
informed
informed
before the
before the
kidney
kidney
disease could
disease
get
could get
to its
to its
worst
worst
point?
point?
No, like I told you, I didn't even know. I'm waking up. Like, what's going? What you talking about? Kidney failure. Where this come from?
Right.
Right.
So no, it was a shock to me. But having sickle cell dis-ease, I know it comes with the territory in terms of things not acting right or things deteriorating or you know
Yeah,
Yeah,
I
I
do
do
feel like
feel like
doctors
that
being
being
informed
informed
you
you
much at
much at
all
all
until it
until
gets
it gets
bad.
too bad.
And by
And by
that
that
point,
point,
you're
you're
already
already
at a
at a
disadvantage.
disadvantage.
Right.
Like, cause I
Like, cause
could
I could
remember
remember
I had a
I had a
hematology
hematology
test
test
before I had
before I
my
had my
period,
period,
and
Mm-hmm.
and
it was
it
like,
was
"Oh,
like,
your
"Oh, your
kidney
kidney
numbers
numbers
don't look
don't
too
look too
great, but
great,
it's
but it's
okay.
okay.
There's
There's
nothing to
nothing
worry
to worry
about
about
right
right
now."
now."
And I
And I
asked
asked
myself, "Okay,
myself,
what
"Okay,
can I
what can I
do
do
to,
to
get them,
get them,
or
or
what can be
what can be
done?" It was like,
done?" It
"Oh,
was like,
no,
"Oh,
you're
no, you're
okay."
okay.
And then
And
I
then
had
I
to
had
go
to
and do the
go and do the
research
research
myself.
myself.
When
When
why
why
not
not
tell me
tell
these?
me these?
And
Mm-hmm.
that's
And
why I
that's why I
love
love
the
the
specialists that I
specialists that
had
I
in
had
New
in
Mexico
Mexico
too,
too,
because
because
they
they
knew how
knew how
important it
important
was
it
for
was
me
for
to
me to
not
not
go on
go on
dialysis.
dialysis.
Mm-hmm.
And
And
one of my
one of my
doctors, she
doctors, she
really
really
like
like
helped me
helped me
devise a
devise a
plan a
plan
few
a few
times
times
to get
to
my
get my
numbers
numbers
where they
where
needed
they
to
needed
be
to be
or
or
around
around
where they
where
needed
they
to be,
needed to be.
whether
Mm-hmm.
it
Whether
was
it was
using this
using this
medicine to
medicine
take
to
me
take
off
me off
this,
this,
try
try
eating
eating
this,
this,
try stay
try
away
stay
from
away from
this.
this.
And,
And
we had
we
lots
had
of
lots of
different parts
parts
where
where
I ended up
I ended up
trying
trying
cheap,
cheap,
trying to
trying
we
to
both
we both
come
come
out,
out.
it's gonna
It's
work,
gonna
we're
work.
gonna
We're
make
gonna
it
make it
work.
work.
Mm-hmm.
And she was
And
such
she
an
was such an
inspiration
inspiration
herself.
herself.
She only
She
had
only
one
had
kid.
one kid.
So
So
Mm-hmm.
she,
she
she
knew
knew
the
the
struggle
struggle
that I was
that I
going
was going
through.
through.
So
So
yes,
yes,
I can
I can
honestly
honestly
say,
say,
no, I was
no, I
not
was
informed, not
informed, not
by
by
the
a
doctor
doctor
right
right
away.
away.
I feel like
I feel
Right.
once
like
I
once
got
I
to
got
that
to that
point,
point, it was already
the
the
damage was
damage
done.
was done.
It was
It
Yeah,
was
already far.
nobody
hard.
told me, like, they take these CBC blood works all the time, but they looking for certain things. And if other things are showing up, they not telling us. They never told me. I never knew that maybe my numbers was creeping up from time to time or something. I didn't know.
Yeah,
I didn't know at all.
these
These
doctors got
doctors
to
got
do
to
better.
do better.
Yeah.
Okay,
Okay,
this is one
this
of
is
my
one of my
favorite
favorite
questions
questions
right
right
here,
here.
because
Because,
we getting
we
ready to
ain't
break
ready to
it
break
down
it down
now.
enough.
So the
So the
question
question
is,
is,
what did
what did
measure
measure
the
the
kidney
kidney
disease
disease
stages to
stages to
dialysis look
dialysis
like for
like for
you?
you?
Because you said
Because you
you had
said
a
you had a
you weren't on
weren't on
dialysis.
dialysis.
I'm sure
Sure,
you were
you were
very
very
proactive
proactive
and
and
did
did
things.
things.
So we're
So
gonna
we're
kind of
kind of
unpack that
unpack that
some so that we
so
can
that we
really
can really
give
give
people
people
hope and
hope and
pointers
pointers
on
on
how
how
they
they
might be in
might be in
that situation
the
right
situation right
now
now
to
to
Yeah. What I'm doing now is really advocating to the warriors. Please watch what you eat now. A lot of the candy, a lot of the soda, a lot of the sports drinks have what they call phosphorus. And phosphorus is a thing that is one of the things that they clean out of your blood, and it's one of the things that they look at in terms of how it works with your kidney, right? And how it works with the combination of breaking down um, what I want to say. Okay, so it's a gland in your throat that deals with the phosphorus, and phosphorus helps with breaking down calcium for your bones. And so, if the number is too high, then it's not helping to break down the calcium uh, so that it can go where it needs to go for your bones to be supported. And so, um, if you're taking calcium and this gland is not working properly, um, when then you're not really getting the nourishment or the nutrition you need. And so that number have to be down. this gland has to properly be working. And then um, it also, you know, helps with the alkaline of your body, like your blood, the acid. Like sometimes you can have a lot of acid in your blood. They got me on the sodium bicarbonate, and it's just baking soda, really. That's what it is, to help keep that acid down. And and then some people need potassium because some people got low potassium, some people got high potassium. But either way it go, if you're too low, it's not good for you. If you're too high, it's not good for you. But for me, I have to make sure my potassium is down, because that also has something to do with the kidney function and the numbers that they look at. So they look at calcium, phosphorus, um, the creatinine, and there could be some other things, your protein level, some other things that they look at just to see how your body um, is functioning. And so for me, you know, I don't worry too much like I used to when I found out that there's potassium probably in everything. You
Yeah.
can't you can't get away from it. And so what I found out is that it's really about um what I want to say, cuz I was like I can't have it. I just can't eat it. But it's really not that. It's just really choosing like leaner stuff, more healthier, organic kinds of stuff. You can't bypass some of these things. And it's just if you have a cleaner diet, then your body knows what to take off of it. And then, I don't worry too much if I, you know, have some broccoli or something like that or fruit. I just don't have as much of it because I know it has potassium in it.
Mhm.
Um, and there's no way of getting around it. So you can eat things like strawberry, blueberry, raspberry. All the berries are very low in those things. But like the melons, they are very high. So, everything in moderation. So I
Mhm.
don't eat, a half a watermelon anymore because I just love, that's one of my fruits. I love it. I just may have a couple of pieces now just to satisfy that taste because I can't have the potassium, not a lot of it, so I don't want to shoot my numbers off,
Right.
Right. But managing it for me is knowing when I feel like I have fluid on my body and knowing when I don't have fluid on my body and know that, all they need to do is just cleanse the blood and not take the fluid. And if I feel sometimes like when I feel a little short of breath or feel something in my belly area, that's kind of my signal that something is not coming off. It's just sitting there and it's making me bloat. So it's like, okay, they're gonna have to take this off. They're gonna have to not only cleanse my blood but draw off this fluid. That's how I can tell um, when maybe I might have ate something that had too much of something in it and I didn't know, you know. But my body tells me now, and I know how to correct for that. And when I do that now, I either I can flush it out through drinking water and fasting. And when I fast, skipping a couple of meals and stuff, it helps me to digest whatever it is. at a slower pace, but eventually, whatever that is that I ate that wasn't right, it'll come out because my system still work, and then that bloatiness will go away. Um, but you know, this last time I got on, that was happening. I was starting to, this is the best way that people with kidney failure can tell if they're retaining waters by taking your weight every day. If it fluctuate 3 to 5 pounds or whatever, you are beginning to retain weight. But if you go up like 2 pounds or whatever, and you go to sleep and you wake up and it's gone, then you're not retaining it. But if you get up and that pounds are still there, you know, you're retaining the water. And so that's the best or quickest way to know when your kidneys are not functioning properly and you
Yep.
are gaining weight.
Especially the water weight pulse, because I know I had that issue. Sometimes it would my legs would swell, ankles would swell, feet would swell. I had a big problem. Sometimes I have a big problem. Potassium being high. And for almost a year, I really tried to get to the strict low diet.
Mm-hmm.
First of all, one thing I learned is that if I do low potassium for too long, it gets too low. So that was one of the things that kept happening. And then when I tried to say, okay, mostly low, I had no energy whatsoever. None. Like all I would do most of the time. And don't get me wrong, times where I do feel, but I'm a very proactive person. Not like a lot of times my daughter. I like to work on several things at once, and I couldn't do it honestly.
Mm-hmm.
All I could do was sleep. And so I knew that I had something different. So I decided to take medication called low which lowers potassium.
Yes.
It helps you it helps you to get out of your body. And that mixed with a moderate low potassium. Still on the low side, but every now and again I'll treat myself to something. And most of the time my numbers don't honestly. And then there are like, okay, you was a little wild. You was tripping a little bit. Time to snap it back together. Snap it back together. You got it. So in those times, I was able to just dedicate myself to bettering my health.
Mm-hmm.
Now, as far as the type of diet I had, this was important, especially because I had to walk around between sickle cell and kidneys. Because just because I'm helping one thing, I could be hurting the other. And which is why I was so low energy, because there are certain things you need with sickle cell that kidneys like you ain't even supposed to be down.
It's such a delicate balance. Kidney disease, not too much water. Sickle cell, hydrate.
Yeah.
It's such a delicate balance.
It is. When I really try to cut out the green leafy veggies, that is a kryptonite for somebody with high potassium. But it is a superpower for somebody with sickle cell. If you really put it in perspective, so
That's true. You can get too much of the vitamin that's in the green leafy vegetables. It might be too much for the kidneys.
yeah.
But for sickle cell, bring it on.
Sickle cell be like, yo, I like that. Run that a little bit.
Sickle cell is like, yeah. There I go. I feel real good. Kidneys like, no.
Like, this ain't it.
This ain't it.
So it is very delicate balance. Blueberries are very good.
The best. I love them. Yes, the blueberries, the blackberries, the strawberries.
Yes, and those antioxidants. Baby, let me tell you something. it hit different. Also, red grapes are the best grapes to try to eat. They're good for your kidneys. Yes. Cauliflower instead of broccoli. I know some people are like, what?
Right?
Yeah. Cauliflower instead of broccoli.
Yeah.
Pumpkin seeds. Yeah. I didn't know for a while when I found that out. That's something. Me.
And cherries.
Huh?
Cherries.
Yeah, I can.
Cherries, the cherry tart drink, and all that stuff. All that's good for the kidney.
What'd you say?
The cherry tart drink.
You're breaking up.
No. Okay. No. I was saying the cherry tart drink. Can you hear me now? I don't know what's going on.
Maybe try to come right back.
Okay, can you hear me now? Still breaking up? Oh, that's you. Look like we lost her. She should be back shortly. Girl, that was you.
It was as good as I
Glad you back.
Yes.
Let's move on to the next because I wanna get this going because I got a long way home.
Alrighty. Okay, so what happened to the part about what is dialysis? Because some people are not. I mean, I know we're talking about it, but just really quickly let's lay it out. All in all, dialysis is a process that cleanses your blood for you. Kidneys are no longer able to do it.
It's a twofold process. Cleanse the blood and take the excess fluid off.
Yeah.
Some people with kidney failure are no longer peeing and can no longer, clean their blood as well. So they need both. Some people like myself and maybe like Shay, we just get our blood clean because we can still use the bathroom. We can still urinate.
Yeah.
So that part of our kidneys is still functioning. The other part that cleanses the blood is just not functioning enough.
Right.
So we need a little help from the dialysis. And so to me, years ago, it's like if you got kidney failure, it was like you were sentenced to a life of dialysis. But that's not true today. Now it seems like they're realizing that, just cleansing the blood, doing what's necessary to give the kidneys a little help is good enough. And Some people kidneys wake up, pop right back off dialysis, right? That's what I'm aiming for and hoping for. However, I can accept the fact that maybe mines just need cleaning every now and again, and I will never be able to, get rid of the port because I always have to have access to just get my kidneys clean every now and again. I can live with that, if that's the case. But, I'm going to do every ditch effort to see if there's other, things that I can do in terms of diet and medication to maintain, what I have. So, you know, that's where I am with it. And so it's not really a death sentence or a thing that you may have to look forward to. And they also have, like, I think it's called is it peritoneal or something like that? The P.
Peritoneal
dialysis, where you can do it at home at night in your sleep and then wake up and, you know, have the rest of your day to yourself. So that was something that they were considering for me to do it at home and on my own time and then to fit my lifestyle because I'm a very busy person. Something to consider. There's other options,
Yeah, because
I just want to say
that
that
you
you mentioned
mentioned
peritoneal dialysis.
it is
It is
actually
actually
better for your
better
heart.
for your heart.
Easier.
Easier
Yes.
on your
heart.
It's easier on your body. Yep.
Yeah,
Yeah.
because
Because
you gotta
you gotta
think.
think.
You go to
You go to
dialysis
dialysis 2
2 times a
times
week.
a week.
That's only
That's
2 or
only
3
2 or
times
3
a week
times a
that
week
your
that your
kidneys
kidneys
are
are
getting that
getting that
release.
release.
You know that
that
it's not
it's
having
not
to
having
work
to work
so
so
hard.
hard.
So
So
when you're
when
doing
you're
it
doing
every
it
day
every
with
day with
peritoneal
peritoneal
dialysis,
dialysis,
it's
it's
just better
just
for your
better
body.
for your body.
We said.
Right.
Okay,
Because
we
it's
have
not taking the blood out of your body and putting it back in and all that stuff. It's just really working with cleansing.
yeah.
Yeah.
Mm-hmm.
What?
What?
How do you
Why
have
do
a
you have a
where
where
Okay, so
Okay, so
one of our last
our
questions.
last question.
Okay.
How do you
How do
maintain
you maintain
job
job
receiving
receiving
dialysis?
dialysis?
Maintain a job.
Mm-hmm.
Mm-hmm.
Work around your schedule. How do you travel? How do you do anything? It's like, you know, um, as long as I may get one treatment a week, it's good for me because I don't swell and none of that kind of stuff. So, um, if I have something to do on a Saturday, because Saturday is one of my days that I go,
Mm-hmm.
I just let them know in advance. Hey, I'm coming in Tuesday, but I won't be on Saturday. I'll be back next Tuesday. It works out. If I'm going out of town, I'll make sure I'll get dialyzed or get dialyzed the 2 days out of the week or something like that if I can. And then I'll just when I come back the next week pick up where I left off, or when I come back pick up where I left off. I don't schedule to have dialysis out of state, or what you can do.
Yeah.
Yeah. That's no problem. They can set up everything for you um, if you need to do that. But sometimes I'm not gone long enough to do that. It's like if I miss one session or two, it's not going to hurt me. So then I'll just come back and pick up where I left off. Yeah.
Have you ever
extended
extended time
time
without?
without?
I don't know why I
I don't know
can't
why I
speak
can't
English
speak
tonight.
English tonight.
An
An
extended time
extended
without
time without
dialysis.
dialysis.
Yeah,
The
let's see, September the 7th, my doctor ordered me to be off dialysis for a week to see how I did. Then what happened after that was, um, I think, yes, I went, it was a convention I went to. So I couldn't follow up because I think that next week I was going to a convention. So I was off dialysis the week before the convention, and then that week of the convention, and then until I got back. So when I got back, I was going to follow up. Now it's putting me closer to the end of the month. So then what happened? I get sick the end of September when I was supposed to have my doctor's visit to determine if they were going to take the port out. So what happened? I get sick, have a sickle cell crisis, and because I still had the port, you cannot discharge a patient who has a port for dialysis and release them back out into the world without releasing them back into a dialysis center. So by me getting sick, then triggered me to have to go back through the system because the hospital has no choice but to make sure they release me back into a dialysis care, right? Until I can follow up with my doctor to determine what is going to happen. So, needless to say, because of the insurance change too, the doctor who was ready to take me off of dialysis because of my insurance change now has no say, right? So the new doctor, the 30 days that she wanted to wait, I did the 30 days for her without being on dialysis. But the day I was supposed to check in with her, I was in the hospital. So then I couldn't check in with her until my next appointment time. But in the meantime, I've been placed back on dialysis, but only for a short time, the hours, 2.5 hours, and twice a week until they can figure this thing out. So that's where I am right now. So now the doctor who was my primary doctor is the doctor that sees me over dialysis, but he only sees me at the facility, not in his office, because he don't take my insurance. The facility takes my insurance. And then I see the primary doctor in her office, but she's now explaining to me that she's saying that my doctor is my primary doctor, and because I can't have two nephrologists. And so I'm like, I'm so confused. So I told her, have your lady call me to explain this because I don't see how when my insurance changed, and I don't even know how this is really supposed to play out. So I'm like in limbo right now with my with where I am in terms of, am I getting off or am I staying on? So just to be on the safe side, I'm just following them and I'm staying on, and I'm gonna let them, you know, do their tests and do what they have to do so that we can thoroughly know to make a very informed decision about what my next step should be. That's just where I am right now.
Absolutely.
It's crazy.
No, I
No,
get
I
it.
get it.
It can
It
be a
can be a
lot.
lot.
I'm
I'm
told I
told
need
I need
kidney
kidney
transplant.
transplant.
Isn't that funny? I was telling him, I was like, I mean, he was like, I'm gonna give you this, I'm gonna give you stage 5. I'm like, why are you rushing it? Why are you talking about you gonna give me stage 5? Like, am I at stage 5? No, just in case, just in case, just in case. Why you wanna just in case me for a kidney transplant. When my kidneys might wake up and say, "Hey, I was just asleep for a while. I'm back." You know, like it was crazy. It was like, yeah, so you could be put on the list. I'm like, what's the rush? Like, is it necessary, or are you just telling me this? It was so confusing.
Yeah, it
it
is
is
confusing.
confusing. Like,
I
I
don't
honestly
feel
don't
like
feel
my
like my
kidneys
kids
are
are
that
that
bad.
bad.
I know they're
I know
bad,
they're bad,
but
but
I
I
don't
don't
honestly
feel
feel
like
the
they're
way I
like,
use the bathroom. It's like I know I should be cleaning something.
yeah.
Because
If I
the
go,
way I use the bathroom, it's like I know some the toxic stuff where the stuff that don't belong in my body has to be coming out of this. You know what I mean?
mm-hmm.
But I don't have
it
any way to know to tell. All I know is that they give me those urine tests, those 24-hour urine tests. I bring that thing back full, and they be like, "This come out of you?" Yes, I told you.
Right, I gotta do
I
my
gotta do
first
my first
one
one.
since I
Since I
started. I've
started,
been
I've
there
been
since August, and they
August, and
just
they
done
just
through
done
me
through me
the
the
24 hours.
24 hours.
So
Yeah,
I
I
would
did
I
a
would
couple
get
of
that
them, and it's like
tomorrow.
they just be like, "Oh, okay, very good." Like they just like they numb to the fact. Like I'd be like proud, like look at this,
right.
Right.
but like look at this, look how much I brought in. Aren't you
Thanks, Cass.
proud?
Yeah,
Yes,
I wasn't
I'm
sure if you
sure
all
if you
can
all
hear
can
if
hear
it was
if it was
an echo.
echo.
I'm sorry.
I'm sorry, I
I apologize.
apologize.
I
I
did not
did
know
not
for an
know for an
hour.
hour.
I was
I was
echoing for you
echoing for
all
you
too. I
all too.
thought
I
I
thought
just
I
was
just
the
was
one
the
who
one
heard it.
who heard it.
Oh, okay, so the audience heard it.
Yeah.
Yeah.
Is it better?
I
I
can try taking the
taking
mic
the
out.
mic out.
Let's see.
Let's see.
Mhm. Any other questions?
Yeah.
Yeah.
If there's
If there's
anyone who
anyone
have
who
any
have any
questions,
questions,
please make
please
sure
make sure
you
you
ask your
ask your
questions.
questions.
Yes, because Dr. Obama Fifi got a long way to go, honey child. I got to get out of this office and head on home.
Cassie, we
Cassie, we
almost
almost
down now.
down now.
So
So
we can try
we can
this at
try this at
another
another
time,
time,
another date.
another date.
But
But
everybody gets
everybody
the
gets
gist of
the
it.
gist of
Sorry,
it. Sorry,
I
I
apologize in
apologize in
advance and
advance and
after
after
for the
for the
echo.
echo.
But we
But
did
we
give
did give y'all
a lot of
a
great
lot of great
information.
information.
So if you
So
can
if you can bear to
stick
stick
through it,
through it,
it'll be worth
it'll
it.
be worth
It'll be worth it.
And then
And then I'll
make sure I keep in mind that we'll do
we'll
another.
do another.
Other than
Other
that,
than that,
just real
just
quick,
real
I
quick, I
wanted
wanted
to
to
again, if anyone
if
has
anyone has
questions right now, feel free to ask those
ask
questions. But I'm
questions, but I'm
going
going to
went this
went this
far.
far.
We talked
We
about what
talked
it
about what
feels
it feels
like.
like.
We talked
We
about
talked about
I
haven't
just real quick
quick
about the
about the
maintaining the
maintenance
job.
job.
You do
You
have
do have
some rights
some
under
rights
the
under the
ADA. I
ADA.
just wanted to make sure I said
I
that
said that
because
because
I'm actually having
having
issues with that right
that
now.
right now.
You have
My
to do
hours
what now?
Hours changed.
You do have to do what? What you telling the people?
The
The
rights that
that
everyone
everyone
has under
has
the
under the
ADA
ADA
Oh, okay, yeah.
for accommodation
accommodation
for
for
you
you
from your
from your
job
job
if you need
if you
them.
need them.
I
I
definitely
definitely
do. My
do.
schedule
My schedule
changed.
changed.
It does
It
not
does not
fit
fit
with my
my
schedule that I've
that I've
already
already
changed
changed
for my
for
job.
my job.
Mhm.
So they're
So
gonna have
they're gonna
to
have to
meet me
meet me
halfway
halfway
through,
through,
baby.
baby.
And I have
And I
that
have
right
that right
because I'm
because I'm
protected under the
protected under
ADA.
the ADA.
I just wanted
I
to
just
make
wanted
sure
to
I
make
kind
sure
of
I
covered
kind of
that
covered
part.
that part.
Yeah.
All right.
All right.
So we
So
are
we are
almost out. I just wanted to kind of really
really
briefly talk
briefly
about
talk
the
about
Kidney
the
Patient Act
Patient Act
in
in
Nevada.
Nevada.
They're
They're
gonna
gonna try to start
charging
charging
patients
patients
basically for
for
medications
medications
that they
that
need
they
kidney
need kidney
patients.
patients
So like we talked about phosphorus and how it's important to keep it low. Most kidney patients are on phosphorus sparing dose. They want to make it to where you only take your phosphorus during dialysis, which is counterproductive. Because phosphorus, the purpose of a phosphorus binder is in the name. When you eat, it binds the phosphorus. Right? So if you're not taking it anytime you eat, what's the point of taking it? At that point, it's fiddle with no flavor. Okay?
Right.
I just kind of want to take that. Just kind of break it down just a little bit. I'll go over that for next time because there is an echo. And just really quick, a resource that I found, which can be really helpful for people with kidney disease, is the American Kidney Fund. Go to the AmericanKidneyFund.org. They can help you with a number of things, especially if you have kidney disease, failure, and you're on dialysis. It is established for say if you have a copay for your health insurance, they'll pay that. Certain things you help to rent. Different things. It is a variety of resources for this organization. So yeah, I just wanted to make sure I gave you all that resource because it's important. And yeah.
Awesome.
If there's nothing else, I don't see no questions. I gave you all a little bit to get it in. But yeah, I want to hold you to you want to go an hour. I'm ready to go.
Yeah, it's gonna take me some time, but yeah. All righty. Well, this has been my pleasure. I hope I helped somebody to understand a little bit better. This is my life, and I'm living it.
Absolutely.
Nothing.
And if you're going through it, it's confusing. I don't know English today. It's a confusing time right now. If you're going to the midst of that, and hopefully provide clarity to you all.
It's not a death sentence. You can get through it.
And honestly, that was for me. It was a very big like anxiety because again, you went through it. I saw the end result. And it is a struggle still. I'm not going to be like, oh yeah, and it's never hard. Some of the hardest life has been. It will challenge you. It's gonna pull a couple of coattails, I'm telling you. But you can get through it.
If you love yourself, you can get through it. Keep loving yourself. It doesn't make you less of a person. It has nothing to do with your character. It's just part of the course. And as long as you can educate yourself and find ways to cope that's beneficial to you, you can still live a good life.
Absolutely.
And I'm happy. I'm happy with myself. I'm happy with my life. And sure, some days are better than others, but I'm still glad to be alive and wake up and do what I got to do. Start all over again.
Right. You know what they say? It's not about the size of the dog or the fight. It's the size of the dog. So since they're coming back kid, I just look forward to being back. But without further ado,
y'all,
I'm not gonna hold nobody too long.
If
I can still
I
hear
can still
the
hear the
echo. I'm
echo, I'm
pretty sure
pretty
you
sure you
can.
can.
So I will
I
leave
will
you
leave you with
positive
positive
system,
wisdom,
which
which
are
are
start where you
start where
are,
you are,
use what
use
you
what you
have,
have,
and do what
and
you
do what you
can. Until
can.
next
Until
time,
next time,
folks.
folks.
Peace.
Peace.
Later. Thank you. Bye-bye.
Bye.